Hi and welcome. My name's Hannah Hilton. I'm a physio at Barts Health in London. And this is Emma, who's here to help me today.
Hi, I'm Emma. I'm a student physio at King's College London.
So my specialty is in breathing pattern disorder and complex breathlessness. And so what we're going to do today is just look at the topic of breathing and walk through breathing together. So we're going to look at a few different components of that, just to give a little bit of background as to why I end up doing this clinically. Lots of patients who come to see me have complex breathlessness. Sometimes there's pathology linked with that, sometimes there's not, and almost always breathlessness is multifactorial. So what we start with each of our patients is a really good understanding of how we breathe. And the way I often explain this to patients where things have gone wrong for them is that breathing is a little bit like walking. So we each have slightly different ways of doing it, slightly different techniques. It's not necessarily a problem until it becomes a problem for us. So in the same way with walking, we might actually have changed how we walk to protect an injury, and it ends up giving us hip pain and back pain, when actually the first injury was in our foot. And in the same way with breathing, we might have changed our breathing slightly to cope with an illness like COVID. And actually those changes have carried on, and now they're causing us more breathlessness and more problems, though the trigger and the initial COVID infections actually moved on. So what we are going to start with is a self-assessment of breathing. And I've got Emma to help me because it's a nightmare to show breathing and talk about breathing at the same time. So thank you, Emma. So let's just start with a really good self-assessment posture. So sitting in a chair, please join with us wherever you are. Find yourself almost certainly sitting in a chair already. Make sure your legs are not crossed and your feet are on the floor. Try and have your back up against the back of the chair. So we want to ideally have our postural muscles switched off and really relax some of those extra muscles that might be contributing to breathing without our realizing. And then we're going to put one hand on our chest, doesn't matter which one, and the other hand on our diaphragm. So again, talking to patients, I'd normally teach them to find their diaphragm by just finding the soft area underneath your ribs, just at the top of your belly, and just letting your hand rest there gently. Now, we want to make sure that our arms are not sticking out like chicken wings, but resting in nicely at our sides. And our shoulders should be relaxed, but we're still upright against the back of the chair. Good. So when we come to think about breathing, we want to be observers of our own breath, which is really hard to do because when we start to think about breathing, we overthink it and we start to change. So just taking a moment to really observe what's going on with your breathing now. See if you can spot anything that's varying in your breathing or anything that's rhythmical, and then we'll go through it systematically together. So just to start with, pay attention to the airflow that's coming in and coming out. So are you mouth breathing? Are you nose breathing? Or are you switching between the two a little bit? And as physios, we're obsessed with nose breathing. So if you ever talk to respiratory physios, we love nose breathing. And obviously there's lots of clinically really good reasons for that. But most of our patients who come to us with breathing pattern disorder really struggle switching from mouth breathing to nose breathing. And there's quite a lot of work we have to do with that. And it's worth being aware that patients with clinical or structural changes nasally or in the sinuses that makes it very difficult for them to nose breathe, they also often end up with some of these symptoms of complex breathlessness too. So if you're able to make yourself adjust to that nose breathing and that doesn't cause you too much breathlessness, then we're going to try and stay in nose breathing. We're then going to pay attention to what muscles are moving. Now, I just want you to have a little think about which hand is moving more, if they're moving about the same, if one doesn't feel like it's moving at all. Now, as many of us are probably aware, we would like breathing to always be coming from our diaphragm. So we want to be feeling movement down here. But actually, even that shouldn't be exaggerated movement. It should be quite subtle. And again, I talk to a lot of our patients about the awareness that we shouldn't be obvious with our breathing. So back before COVID, when crowds were a thing, I'd often tell people to have a look around a bus or a train carriage on their way home from clinics and have a look at other people breathing, because it should be silent and it should be effortless. And if it's not silent or effortless, then something is going on. And that may just be in response to exertion or an environmental change, but it's something to be aware of. So it's fine to have a little bit of chest movement, but we want to try and have more diaphragm movement than chest. And for a lot of our patients, again, we have to really focus on isolating the diaphragm to reduce what's going on up here. And we can see here with Emma that really nicely her shoulders are relaxed and they're not actually fixed or working with the breathing. But again, we recognize that for lots of people, that's not the case. And again, we often have to work at people learning to switch off up here in order to be able to activate down here. So what we're seeing here is actually really nice breathing. So Emma's very good at breathing, as we all are, depending on what changes we've got going on. So what we want to think about now is a little bit more about what's going on inside. So we want to think about the size of the breath and the rhythm of the breath. So I'm going to just allow a minute where we go back to that hands-on approach, go back to that feeling of breathing. And I'd actually just encourage you to close your eyes and just allow that breathing to occur over the minute. And I want you to think about the shape of breathing, which is a strange way of thinking about it. But if each breath has a shape, so we breathe in and we breathe out and then we go again, is each breath the same size and the same shape? Or is it getting faster or slower? Or is it higgledy-piggledy? So we're just going to silently keep looking at that breathing for a little bit longer. Good, and relax there. Excellent. So hopefully you were able to identify a few things in there. Emma, how was your breathing?
Lovely. Very peaceful.
Was it nice and rhythmical and smooth?
Yeah, my exhalation was longer than my inhalation, I noticed.
Okay, so that's ideal. So we'll all get some variations within our breathing, and for many of us that is normal and that is totally acceptable within what we're doing. For others, that is a little bit more problematic. And the thing with breathing really is we're only ever concerned if it's causing us a problem. And for many areas of physio and many specialties of physio, we find endless variations, but we tend to only ever focus on them if they're causing the patient a problem. So that is a really simple way of assessing our breathing, being aware and identifying problems that are there. I know I haven't given kind of clinical remits of what we would be concerned within that, but if this is an area that interests you, then I'm happy to have conversations about this further. And I can also recommend looking at the Brompton breathing pattern assessment tool, which is a tool that can help with the assessment of this clinically. Again, if you contact me, I can put you in touch with the team who are behind that assessment tool as well. Thank you, Emma.
Okay.
Excellent. We will come back with another video shortly, which just looks at a few of the techniques that we use around breathing as well.